Welcome, ladies and gentlemen, to the second day of our conference, Libraries in a World of Change. We have another exciting day like yesterday, and our speakers are very excited, I believe, to join us. They would have loved to have been with us live, as they say, not just through the screen, but to really join us in Lebanon. Hopefully we will be able to host them in Lebanon one day and tell them they're more than welcome. I'd like to go through some points, just to remind you of what we announced yesterday. First of all, that the event is being recorded, including the chats. So if there's a question that we're not able to give you the answer to during the session, we will definitely pass it on to the speakers and maybe they will provide us with the answers. Your audio settings are there, but of course, all our attendees are muted and the videos are off, except for the panelists and the speakers. There's a question tab at the bottom of the screen in case you would like to ask a question later on to any of the participants, the speakers, and I'm sorry. And there's a chat box where you can chat to all the panelists and the attendees at the same time. So then we also have a translation mode available. We're translating from English to Arabic and from Arabic to English, simultaneous translation. If you notice at the bottom of the screen, also you have an interpretation tab, which you can click on and choose the language. So if someone is, if the presenter is presenting in English, you can switch to Arabic if you want, and you can listen to translation as you go on. Our sponsors are in their Zoom booths. Each sponsor has an individual booth. You can go to the conference website and click on sponsors. You will get the sponsors of our conference that are 5. And you will see which is the portfolio of the sponsor and the virtual booth where you can log on and meet with the sponsor or the representatives. And you can also send them a chat through their chat box. You can ask questions. If no one is available in the booth, you can send a message to the chat box. Our sponsors are ProQuest, Nasij, Springer, Taylor & Francis, and Oxford, and we thank them, of course, for their support. And all I can say is I hope you enjoy the conference, and this is the second day, as I said, and have a good day. I will now leave the floor to my colleague, Ghanwa Wahbe, to begin the session. Please, Ghanwa.
Thank you, Randa. Good evening. I'd like to welcome everyone to the first session of our day. This session will discuss a very interesting and yet challenging topic, which is COVID-19 pandemic and librarians. What challenges are librarians facing? What roles and new roles they adopt trying to cope with in the light of this COVID-19 pandemic? In addition to the health information challenge, are all the information reliable or not? And what about the digital health inequalities? So we have a lot to cover today. So let's start by introducing our first speaker, Dr. Annie Brice. Dr. Annie Brice is the head of knowledge management for Public Health England, the expert national public health agency with a mission to protect and improve the nation's health and to address inequalities. Dr. Annie is convener of the IFLA Special Interest Group on evidence for global and disaster health. Annie's professional and research interests include evidence-based practice, professional development, and workforce planning, and participant experience in online clinical trials. So we are glad to have you among us, Dr. Annie, and the floor is yours.
Thank you very much. And I just check that you can see those slides.
Yes.
Lovely. Thank you very much. And thank you very much for the welcome. And it is indeed a great pleasure and honor to be talking to you today. Rapid advances in technology are clearly driving global change and innovation. As information professionals, new technologies can help us provide rapid, tailored information with the power to inform and connect communities. But ethical and social issues remain a challenge, and these, if we're not careful, can aggravate existing inequalities, particularly in times of crisis. The COVID-19 pandemic has clearly demonstrated the growing threats to misinformation, poor access to high quality evidence, and other information challenges. These are often characterized as health information problems. They suggest that we build better resilience in our communities through improving health literacy, information literacy, and digital literacy, and to be better at the way we share knowledge. But I think the pandemic has also demonstrated the interconnectivity between people's health status and every other part of our lives within the societies and communities we live in. So this is a good time to take stock of the role of librarians and information professionals in a global and disaster health context, and also to consider how digital media and communications impact on the health of the public, and how librarians can be better empowered to take a leading role in finding solutions. So what I'm going to talk about today, I'm going to look at a number of things. I'm going to look at what we mean by global and disaster health, talk a little bit about the United Nations Sendai framework, and think about how this links with the Sustainable Development Goals. Talk a little bit about our special interest group and what we've been finding out about the role that librarians can play and why these are critical roles. And think a little bit about the challenges that this digital world is bringing us as information professionals. Bob will then go on and provide a focus on the digital inequalities issue and some real examples of what can be done in practice. So we're all familiar with the messages in these quotes. We know that now, particularly, that health knows no boundaries in terms of nations and states. We also know that when disaster does strike, it's the poorest and most vulnerable communities who come off worst. And within those communities, women and children also suffer most. The second quote comes from Muir Gray, a former colleague of myself and Bob, was the first Chief Knowledge Officer for the National Health Service in England and a great supporter of librarians. And he makes the point that although money and resources do need to be provided, we always need knowledge in the time of disaster. And I would say we don't just need knowledge, we need good, reliable, high quality knowledge. And if we look at some of the statistics provided by another partner of ours, Evidence Aid, they suggested that in 2017, 1.6 billion people had been affected directly by disasters in the previous decade. And that in 1 year, more than $28 billion can be spent on aid. But what do we know about how effective this is and whether it's delivering what people need in their communities? Those figures also represent certain types of disasters. And we'll come back to that in a minute. What do we mean by disaster and how wide does that definition take us? So in 2017, I bumped into a senior colleague in our organization who has a lead role in disaster risk reduction and global health. And she challenged me and asked me, what were librarians doing to support the Sendai framework? So at that point I learned, because I had to admit at that point that I didn't know what the Sendai framework was. The Sendai framework is one of the 3 landmark agreements produced by the United Nations. So it sits alongside the Sustainable Development Goals and the Agreement on Climate Change. And the important thing around the Sendai framework is that it starts to recognize the role of science and information and knowledge as a way of tackling and promoting its aims. It mentions strengthening the evidence base. it mentions the role of science and technology. It mentions disseminating studies, mobilizing knowledge. Clearly, this is something that we would normally be involved in, and it's something that we wanted to get involved in as well. So a call to action, if you like. And this quote from Virginia, the consultant that we've been working with, sets out a call for there to be leadership in librarianship around how we get more involved in these global processes. I'd received a similar call to action the year before at another conference of librarians, where Liz Grant, who was then the director of the Global Health Academy at the University of Edinburgh, also asked a group of librarians what they were doing to help tackle inequities in global health. She said, there are many solutions. How do we find them? How do we know what works? We need to not reinvent the wheel. Or as my former colleague used to say, we need not to reinvent the flat tire. We need to know what works and what doesn't work. But we need to listen. We need to represent the stories we hear, but underpinned by evidence. So let's just go back for a minute to what we mean by a disaster. So generally speaking, we're familiar with hazards that occur from natural disasters, from technological hazards, from disease. And I have to say, it's a bit of a relief for once to not have a picture of the coronavirus. So this is obviously a different pathogen. Environmental hazards, hazards caused by climate problems, humanitarian hazards, geopolitical and post-conflict hazards, violence, terrorism, externality, things that might appear through space, weather, trade dispute hazards. And here we're getting onto less familiar territory, financial shock hazards, cyber hazards, things that happen in transport. And the point that the Sendai framework is making, and the work that's carried on since then, is that all of these hazards all present threats to people's health. So although they seem to be from a wide range of different areas and disciplines, they're all things as communities that we need to be concerned with. So this work from the United Nations and the World Health Organization is still carrying on. And these pieces of work represent quite a large area of activity, including a lot of science, a lot of technology, and a lot of dissemination. And my question really at this stage is, what role are librarians having in the planning, the production, the implementation, and the use of these frameworks in our communities? How involved are we in the whole process of this work? So that's a little bit about disasters and how we frame them, how we define them, and how the world is trying to take a systematic approach to tackling them, preventing them, building back better after disasters, being aware of risks. And librarians are a fantastic asset because they're based in people's communities. So what are these roles and what should we do about them? So following these challenges, we set up a special interest group for IFLA, Evidence for Global and Disaster Health. And it got three main aims in that group. The first is around advocacy, to make sure that the role of librarians is better understood by those in positions of policy making, government, world organizations and action. Everything from people within humanitarian agencies to states, to the United Nations, the World Health Organization. We know what we can contribute, but we need to make sure that we make that role clear and that we advocate as strongly as we can for the role that we can play. So we've been doing some work to try and improve advocacy, working with partners such as Virginia and our organisation to reach out to all sorts of groups and interests to suggest that we work more collaboratively with them. So tackling that strategically is important, but it's also really important to help people practically. So we set out to look at ways of training and mentoring using what were face-to-face meetings, but obviously more virtual interventions now, to help librarians gain the skills, capabilities and confidence to respond to these emerging roles. And as ever, it's good to make sure that people are aware of what librarians can do, but we have to actually have the skills to deliver those roles. And then we also felt that we could have a major role in making sure that we knew what was going on elsewhere, that we could map initiatives across the world, share those with people, signpost to good things already going on, to make sure that we reduce the duplication and that we also brought all these different communities together and we could share and learn from each other. And that has been the most wonderful thing about this special interest group, is the nature of that communication, the people we've met and the people that are joining us to work on this group, such as being here today. That's a real treat. And why librarians and why IFLA? Well, librarians are essential because they are community-based, but they're globally connected. And IFLA is by far the most obvious way of really tackling that global connection. We have a professional principle and value aimed at inclusion and diversity. We have a belief in the right for people to access reliable healthcare information. We've also increasingly over the years got more involved in evidence-based practice, in being able to not just hand people information, but to have a better idea of the quality of that information, how relevant it is for the user, and all the traditional skills we've had in the reference interview and helping people answer their questions and their queries comes into the fore. Now we're looking at ways of spreading this work. So ethical values based on IFLA's global vision, underpinned by robust standards and processes, the detail that we know really matters. And as a profession, we've always been user-focused. We've always been based in our communities. We've always looked to try and work out what our users' needs are, even if they're not quite sure what they are themselves, and help them find the best available, most reliable information to help them make the decisions they need to make. So we wanted to work with key partners, but we wanted those to be both in the library sector and non-librarians to bring together that fuller collaboration. So we did some work to look at what was already known. What were librarians doing? What were the issues? We produced an evidence briefing. This is produced by Dr. Caroline de Brun, who works in our team in Public Health England. And what we found was that there was a digital divide in terms of access to content and infrastructure, but that access to timely and accurate information for disaster teams was essential. And this has problems in that there's often no connectivity at times of disasters. So there need to be a way of looking at getting different routes of information to people. New roles were emerging around being knowledge brokers, global health specialists, disaster information specialists. We also found that libraries weren't just delivering health information, but they were being used as places of safety, places where people could recharge their phones or find a connection to the internet, or just be a safe place to be. The briefing found that there are a lot of tools and resources available that could support global health, but not these are accessible to everybody. that social media was being used very effectively, but has massive dangers in terms of misinformation. And critically, that an awareness of the local context was absolutely vital. Another partner that we worked extensively with is an organization called HIFA, Healthcare Information for All. And HIFA conducted a discussion for us on their global network. And HIFA have 36,000 or more people, health professionals, public health professionals, information specialists, healthcare providers and policymakers around the world. And we found that the digital divide was not just during times of crisis, but was endemic in a lot of areas. That the terminology and language you use is a massive barrier. That people need to know and to prepare in advance and have plans in place before disasters strike. And there's a huge gap between what is needed and what is available. But no one player has the capacity to do this on their own. This really needs cross-sectoral, multidisciplinary working. We could increase our people-to-people exchange, even if we have different systems. We looked at the power of prevention. And the statement, again, from my former boss, Samir Gray, that knowledge is the enemy of disease, and it can help overcome there is knowledge that we know that if we put into place now could save lives. It doesn't all have to relate to new discoveries. So what are the roles and skills that are emerging for us as a profession? Some are quite familiar: expert searchers. A lot of people in healthcare have become involved in producing systematic reviews. A lot of people are working as knowledge managers or knowledge brokers. Increasingly, we've had to become a lot better at being a marketer or a publicist. We certainly need to understand digital literacy and how everything we do with our users can help them in other areas of their lives. And we've also started thinking about how we get involved in policy and strategy. So some of the skills we have are traditional skills, and those traditional skills are still massively important. So the fundamentals of librarianship and information science. We've always had a good understanding about scholarly publication, but now we also need to know about open science and open access. We need to understand about research methods. We need to be able to write and communicate. We certainly also need to know about teaching and learning. But do we also now need to know how to negotiate? If we're going to work as equal partners with other groups, we need to know how to build those relationships. We need to know we need to be skilled in diplomacy. We need to know how to make our points in a way which are going to relate to the people that we want to work with. So we need all of those above. And that brings us a bit of a challenge in terms of how we act as generalists and how much we turn into specialists. And at the moment in my team, we're undertaking some research on workforce planning. What skills are we going to need in the next 5 years? How much data literacy do we need to know about data science? How much do we need to stretch the areas? Or is it enough to know a little and work in collaboration with people? Finally, in the IFLA group, we looked at what our users say. So it's all very well we have quite clear ideas about what we do as a profession and what our skills and our expertise is. But we also need to listen to what our users say they value. So what is the value and impact of what we do? And again, in my team, we collect impact stories. So after we've done some work for people, we often follow them up and say, what did you use this for? What difference did it make in the work you do? So these are some of the things that our stakeholders told us about the work we've done in disaster and global health. That we offer wise advice, that we help them focus on what's important, that we can appraise the evidence to make a better sense of its quality and help them apply it in practice, make the work I do safer, ensure quality and confidence, look for things in a way that I would not thought of, and then try and help them understand why some of the tools they start to use sometimes confuse or surprise them. And I think that's probably something that most librarians would agree with themselves these days when software changes so frequently. And how does this relate then to the digital divide and issues around inequalities? So every part of the knowledge cycle is now being impacted by technology, from the way people ask questions, to the way that research is done, to the way we procure, license and make knowledge available, whether that's in published articles or databases or any of the other, whether we're sending people out texts or supplying, answering inquiries. So all of these parts of the knowledge cycle really do impact on us with the way that technology is changing. If we're truly going to embrace technology for the good it can do, we need to understand and shape it. We need to try and help avoid the over-enthusiastic adoption of technology for its own sake. For instance, one area of my research was around the use of internet technologies in clinical trials. It was felt that being able to use an app on a phone for a trial would open up possibilities and make research more accessible and available in all areas of the world, that it could overcome some of the problems which have been caused by there being a lack of funding and infrastructure for research in certain parts of the world. But actually, when you investigate this, you find that for the people involved, for the researchers and our participants, this set up a lot of problems. They weren't as comfortable with it. They reacted to it in different ways. You have to understand the impact of technology on people to make sure it does good rather than harm. And there are issues around our own relationship with technology. Again, we've been doing some workforce planning, and as soon as you raise the issue of technology such as artificial intelligence or robotics or more machine learning, it's not surprising that as a profession we get some obvious reactions. One of them is this: people feel concerned that their role is going to be replaced by a robot. We are very comfortable and attached to certain of our skills, and it can be very challenging to feel that you're involved in turning those skills into something that can be done by somebody else. So a few years ago, when we started looking at this, we looked at this is a site that was available a few years ago, where you could type in your job title to find out how likely it was that you might be turned into a robot at work and your work. And it's quite interesting when you look at the type of roles that are most at risk of being automated. Those tend to be roles which involve a lot of process. There are also roles that involve accessing and sifting and managing large amounts of information. If you look at the other end of the skills, at the roles that are least likely to be consumed by a robot, they tend to be roles that involve judgment and interpretation, something that you're mediating somebody with. They're obviously involving roles where you have direct contact with human beings. Particularly, it seems to be certainly in our country that the most likely way to maintain your role is to manage a licensed premises, as it says here. But other roles here are all around education and learning. So when you put in librarian, it comes out at the moment as 50-50, too close to call. So I would suggest that that means that we have got the facility to make sure that where we want to be, the more we're involved in this technology and these developments, the more likely we are to be able to make sure that we still have a role in our societies. And I apologize if you can hear the dog barking. This book is very interesting. It was published in 2016. And the premise was that as people were becoming just accepting the fact that technology would make choices for them, that actually they would start paying a premium if a human was mediating some of those choices. Interestingly, even though this book is all about curation, there isn't a mention of any librarians or libraries in the book. And I think we have to think back to what we learned from our experiences when the internet first came around, and also our experiences with evidence-based practice. We can't sit back and let this develop around us. We need to learn about what impact we can make when we focus on our core values and preferences and the way we look after our user communities, how we shape the world, and how we can help shape that world in a way which is ethical and promotes equality. So what sort of things do we need to do? We need to understand the concepts of things like artificial intelligence and machine learning. We don't have to know it in detail. And believe me, at my age, some of these concepts can be quite challenging, but we need to know what it can do and be part of the work to make sure it's used appropriately. We need to have better evaluation methods that take account of needs. And we need to be better at sharing community-based assets. And this is a fantastic role for librarians in terms of how they know, find, and share local-based assets. We need more evidence about our own work, all three types of evidence. So we need the evidence from research. We need to be better at measures, more value and impact measures, not just counting things. And we need the knowledge from experience as well. We need to be really collaborating, cooperating across all the different disciplines that we work with. And we need capacity and capability. We need to keep our skills and training up to date. Most of all, we really need to promote sustainability and equity. Librarians are trusted assets, and all the research you'll find around librarians and how they're viewed stresses this. Librarians are trusted assets, so we need to advocate continually. We need to celebrate the things we're valued for. All too often, I think sometimes that we are almost more concerned or worried about the stereotypes about librarians than other people are. So we need to have the confidence to go out and represent what we do and not just ask for a seat at the table, but be part of the people that bring the table together. Be clear where we can lead initiatives as well as get involved with them. And that needs understanding, knowledge, experience. And this global network of librarians has that in buckets, as we say in the UK. There is a lot, if you put together the combined expertise of all the groups in IFLA, for example, and all the associations like your own, that's very powerful. So I'm going to finish with this quote, which is one of my favorite quotes from Professor R.D. Lanks in America. And that is, to be an information professional or a librarian is to be someone who believes they can change the world for better through knowledge. And maybe we could just add good quality knowledge. So that's all I wanted to say for now. I would, though, like to thank the Lebanese Library Association very much for inviting us to speak, and to Randa particularly for all her kindness and support. to Maria Katera. I don't know if Maria's on the call, but for Maria for bringing us together. I'd like to thank all of the people who've been involved in our Evidence for Global and Disaster Health group, and every librarian in the world who provides such a wonderful community to have been involved with through my working life. Thank you.
Thank you, Dr. Annie. We are lucky to have you between us today. It was a very rich session, which I think we all enjoyed. And now it's time to introduce our second speaker for today's session, Mr. Bob Gann. Bob Gann is a consultant in digital health with a particular interest in bridging the digital divide and ensuring nobody is left behind in the digital revolution. He's currently Digital Health Literacy Advisor to Health Education England and the Library and Information Association in UK. He worked for several years on the National Health Service website as a strategy and engagement director. He is visiting professor in health informatics at Plymouth University. He has published and presented extensively around the world on digital health topics. So let's give the floor to Mr. Bob Gann.
Thank you very much, and it's a real pleasure to be invited to speak to you. I enjoyed meeting a few of colleagues while we were waiting for the presentation to start, and I hope one day I might visit you in Beirut in better times. It was also great just to hear the presentation from Anne. Anne's a colleague and a good friend, and always a pleasure and stimulating to listen to. So let me just share my screen, make sure that's working properly. Can I just check you're seeing that before I move on?
Yes, we can see your screen.
Okay, great. Thank you very much. So I think more than ever before, the COVID pandemic has acutely emphasized how being online is the key to participation in everyday life. During the pandemic, and particularly during periods of lockdown, when we're online, we can do all those essential activities of life. We can go shopping, we can keep in touch with friends and family. We can carry out work from home if our work is of that kind of way of working. We can take part in online classes, and our children and students have had an enormous shift to online education during the pandemic. It's often the way in which we apply for benefits and financial support. It's the way in which we manage our own health. In England, there's been a big shift from face-to-face consultations to consultations with your doctor via a video link or sometimes by telephone, and I'll touch on that in the presentation. And of course, it's the way in which we access reliable health information. So being online is essential to everyday life. But what if we're not online? In the world today, there are 4.5 billion active internet users and a similar number of people with mobile phones. But that still means that 40% of the world is not online, and there's a strong weighting of that to African countries and to some areas of Asia and the Pacific, where very small numbers of people are online, or people are using just a mobile connection without very much data and are therefore digitally excluded, as we call it. And COVID-19 has exposed that divide much more acutely. I thought it was very interesting that back in September last year, our two main medical journals in the UK, the Lancet and the British Medical Journal, in the same week, both had a leading article talking about COVID-19 and the digital divide and the way in which the coronavirus has exposed the divide like never before. And particularly a challenge for lower income countries. In my own country, you may think, you know, we're a pretty online nation in the UK, but 8% of our population are not online at all. So that might mean they don't own a device. Maybe they've never been on the internet at all. Hard for us to imagine as information professionals, but there is a big section of the population for which the internet is not an activity of everyday life. And more importantly, I think, in a way, even people who are online, almost a quarter of the population of the UK don't have essential digital skills for everyday life. So they don't know how to do things like do a search, download an app, enable Wi-Fi, turn on the Bluetooth on their device, those kinds of activities, almost a quarter of the population. And who's likely to be digitally excluded? Who's likely not to be online and using those kinds of online services that we've become so used to during the pandemic? Well, very, very consistently, those people are likely to be older. They're likely to be have a lower income. They're likely to have a lower educational level. They might be homeless. They might be refugees. And there's a very strong correlation between the kinds of people who are least likely to be online and the people who most need healthcare services. So we have what we call an inverse care law, where the people who most need healthcare are least likely to be able to access it in an era where digital is the way in which people are accessing healthcare. And I think that's a major public health challenge. Age and gender are very big determinants of digital exclusion. Sorry, let me go back. In your own country, I was fascinated that although nearly all young people use the internet frequently, people of 18 to 29, according to this data, only half of older people do. And of course, older people are significant users of the healthcare system. And that divide becomes even more pronounced in some of the other nations in the Middle East and North Africa. You can see that Lebanon is one of the more balanced countries, whereas, you know, somewhere like Egypt, there's a very, very small number of older people who are online and using digital services. And globally, far fewer women than men are online. Again, in Lebanon, the balance is pretty good, or very good. In some of the other countries of the Middle East and North African region, a big disparity. And some recent evidence from the World Wide Web Foundation found that in the world's least developed countries, women are half as likely to be online as men. And of course, women are the gatekeepers to family health. They are the people who are most likely in society to look after children and children's health needs. They're also more likely to be looking after elderly relatives and parents. They're probably taking quite a responsibility for their husbands' and partners' health, and of course their own. So we have a challenge if the people who are the main informal gatekeepers to healthcare are less likely to be online than men. So why are people digitally excluded? Why might people not be using the internet? Some pretty consistent evidence around this, including in this very recent report on the data divide from the Ada Lovelace Institute in the UK. And consistently, it's four main barriers. There's a barrier around access. And by that, I mean connectivity. You know, maybe people who live in remote rural areas who don't have broadband connections. It may be about device ownership. People don't have a laptop or a tablet or a phone. and it might be about affordability. And one thing we've found during the COVID pandemic is that there's some pretty deep-rooted digital and data poverty in the UK. And we found some very dramatic examples of families lacking, maybe they have a device, but they can't afford data to use services. So families making difficult decisions between being able to do the weekly grocery shop to feed their family and affording their children's education online because they don't have data. Secondly, there's a deficit, a barrier around skills, and that might be basic digital skills, things like, as I described earlier on, being able to use a digital device, being able to carry out an internet search, but also information literacy skills. You know, it's more than just being able to do those simple technical transactions. It's about understanding evidence, understanding knowledge, being able to distinguish good quality information from bad. Thirdly, we have a barrier around communication. People may have disabilities that make it difficult for them to use online resources and digital technologies. For example, they may have disability that prevents them using a keyboard, or they may have a sensory impairment that prevents them reading a screen. But of course, there's also the barrier of language. English is very much the language of the internet, and a lot of health conditions, there is only information available in English, a lack of good quality health information in languages other than English for minority populations in our country, for example. But increasingly, I think that there's a lack of interest, trust and motivation. There's a view that we may have reached a position in the UK where most people who are likely to get online have probably almost got there. And the problem now is people having a lack of interest and a lack of trust. You know, people who think, well, I could get online, but I don't see how relevant that might be to me. I am worried about fraud, I'm worried about scams. And there's quite a number of people who have that lack of trust and interest and motivation. And I think that needs tackling, as well as those issues of access and skills and communication. So I just wanted to look at 3 ways in which we might combat digital health inequalities. And librarians take an active role in each of these. And these are practical examples of things that are going on in the UK today. Firstly, it's about fighting misinformation through access to high quality knowledge. Health information today is increasingly digital. You know, I've been a librarian for a long time, maybe 40 years. And I remember developing information centres for patients and consumers where the focus was very much on printed information, books, leaflets, and health information now is something that people largely consume in a digital way. Over 80% of internet users have searched for health information at some time. I would have thought it's almost likely to be higher than that. I can't imagine there are many occasions where somebody who is an internet user in their everyday life wouldn't have searched for health information. It's a very ubiquitous everyday activity. And I saw a figure from the Google Health Vice President, David Feinberg, last year, where he was saying that 1 in 7 Google searches are for health information. That's 1 billion searches every single day. And there are over 300,000 health-related apps. So it's an enormous area of information publication and information consumption. but it's also an area of fake news, misinformation. We have a pandemic not only of disease in COVID, but a pandemic of misinformation and false knowledge. Conspiracy theories about vaccines causing injury and death, anti-vax sentiments, conspiracies about how coronavirus came to happen, people saying it's all about 5G connectivity. And we had examples in the UK of groups of anti-5G activists destroying telephone masts because they felt that that was causing coronavirus. And social media has an important role in this, particularly influencers and celebrities who have spread misinformation about COVID. So what can we do to combat that? Well, as librarians, we can be promoting the best sources of information and also guidance on how to spot fake news. So IFLA have produced their tips on how to spot fake news. WHO has a Mythbuster site that on a regular basis takes a particular myth and tackles that. And we've got important resources nationally and internationally where people can go for information about coronavirus and be assured that information is of good quality. And this is an example of UNHCR website for refugees, providing good quality information about coronavirus. So as librarians, we can be promoting those good quality sources of information, and we can also be promoting guidance and tips on spotting fake news. Worth just showing, our chair mentioned in her introduction to me that I used to be the strategy director for the National Health Service website in the UK. And that is a very heavily used source of good quality health information in the UK. It gets about 1 million visits every day. So 30 million visits a month is its normal activity. And during the COVID period, our Prime Minister, Boris Johnson, had a daily broadcast to the country. And at that broadcast, there on his podium was the NHS website URL promoted. And the consequence of that is that activity to the NHS website doubled during that COVID period. And last year, it went up to 2 million visits, doubled to 2 million visits every day. Almost all of that activity of people visiting the COVID content on the website. So I think using every opportunity, you know, whether you're the Prime Minister or whether you're a local librarian, to promote good quality sources of information rather than sources of fake news. Secondly, we can improve the digital literacy skills of the population. So people in our country and in other countries need opportunities to improve their digital literacy skills, whether that's their basic literacy skills in using technology through to those more advanced skills like critical appraisal and you know, distinguishing good quality information. In the UK, we are fortunate to have an excellent network of what are called online centres. So there's about 5,000 of those centres in local community settings. About half of them are in libraries, but they're also in some really quite interesting settings, including there's one in a bar, in a pub. There's one in a fast food fish takeaway restaurant, and community centres, care homes, those kinds of environments. And they provide places where people can go to access technology. So if they don't have technology devices themselves, they can go along and use them in those online centres. And they can also learn digital skills. I was very much agreeing with Anne when she said in her presentation about the importance of libraries as safe spaces where members of the public can go to, access information in a safe, warm, non-judgmental environment. And the loss of those spaces during COVID, when people have been isolated in their own homes, I think has been a major challenge, and it's been tremendous over the last 2 or 3 weeks in the UK to see the opening up again of some of those safe spaces where people used to go. And our Libraries Connected, our Society of Chief Librarians, has produced a nice graphic that shows what members of the public should be able to expect when they go along to their local library and look for health information. So they should be able to look for expert advice from a librarian. Safe, trusted spaces. So we often call that trusted faces in trusted places. They can expect good quality health information resources, signposting to local organisations who might be able to help them, and assistance in using technology and training to do so. And we have in the UK several online training programs that take people who perhaps have some fairly basic digital skills and enable them to develop those skills. There's a package called Learn My Way, which enables people to develop their skills in areas like applying for a job online, applying for financial benefits online, improving your health online, how to look for health information, how to book a doctor's appointment online, how to get your medication request online. And there are those courses for citizens themselves and also for digital champions, so people who work with others in the community, take their skills and cascade that digital knowledge to other people in the community who might benefit from those skills. I often feel, compared with many countries, we're in a comparatively fortunate position in the UK, but it was a sobering and I think brought many people's attention quite sharply to the steps we still need to take in our country when the UN Special Rapporteur for Poverty and Human Rights inspected some social infrastructure in the UK, including the rollout of broadband internet. And his view was that in the UK, rollout of broadband internet may be high, but as I've illustrated earlier in the talk, many poorer and more vulnerable households are not online. And what the rapporteur said was that in the UK, digital assistance has been outsourced to public libraries and civil society organisations exactly at a time when budgets have been severely cut. So in the UK, we've seen the need for support with using digital services. Libraries are ideally placed to provide that support, but budgets for libraries, funding for libraries currently is being reduced, and that seems a very short-sighted policy when libraries could be the most important environment where people go. I was interested in looking at the scope of this conference to see the emphasis on new technologies like virtual reality, AI, digital assistants. So I thought it would be interesting just to include 2 or 3 examples of ways in which, on the one hand, technology that is quite advanced is helping people with some basic digital needs to get more involved actively in their own lives. And I just got 3 examples of that, which I hope you'll find interestingly. Firstly, during COVID, most health consultations have been done remotely by telephone, by an online questionnaire, or by a video consultation with a doctor or nurse. And that can be really helpful to people. You know, for patients are spared the cost, stress, inconvenience of travel, and crucially during COVID, spared the risk of infection. You know, during periods of high levels of infection, people were very worried to go to healthcare environments because of the risk of infection. So being seen by a medical professional via a video link was extremely helpful, and people recognized that opportunity and were keen to participate. But of course, those without technology were denied that opportunity. So again, the people who most needed the help were the least likely to be able to access it because they didn't have digital technology. So we've seen schemes in the UK where digital devices have been provided to people in need. So a particular program where residents in care homes were provided with iPads so that they could access virtual consultations with their doctor. And that was a very empowering thing. I mean, and of course, what happened is that once they had the devices, they didn't only use it for video consultations, they also used it to keep in touch with family and friends, or to do recreational activities to occupy them during a period when you know, they were unable to leave the care home at any time. Voice-activated digital assistants like Alexa and those kinds of devices can be really empowering for people who lack digital skills or dexterity. My son's partner has a 100-year-old grandfather, and he'd never used digital technology at all before until my son and his partner gave him an Alexa device, and he's now doing all kinds of things. He's setting up reminders on that. He's making appointments with his doctor. He's accessing websites and apps. He's getting the football results. And when I was at the NHS website, we did some work with Amazon to make the content of the NHS website available via Amazon Echo Alexa devices. So if you ask verbally in a voice activated way for health information via Alexa, you will get content from the NHS website spoken back to you. And of course, for people lacking digital skills, or maybe people with...
According to the chain.ca, content that is on the Stop Smoking NHS website includes tips on how to quit smoking, the health benefits of not smoking.
So I just realized I've actually done that myself because I mentioned Amazon Echo's device name in my presentation. I have a device in the room here, and as I talk to you about that device, I'm not going to say the name because it will fire up again. It said back to me, you probably couldn't hear it, was just in the background here where I am in the room, it gave me back some stop smoking information. So it was a practical demonstration, but it slightly unnerved me for a moment, because suddenly my Alexa device started speaking to me. And then the third area of technology, which I think is really, really interesting, is virtual reality. So I'm going to tell you a story, because I think this illustrates this better than I could express in any other way. So a project I worked with in Wales, one of the countries of the United Kingdom, was doing a project where they linked care homes with old people with local schools. And this was an intergenerational mentoring program where children of 9, 10 years of age went into the care homes and did activities with the children. And one of the things they started doing was the children, who were quite skilled at using digital technologies, started introducing the older residents in the care homes to digital technology. And in one of the care homes, there was an old man who he was very withdrawn. He sat in the corner. He didn't ever speak to anybody. He used to self-harm. He would scratch himself all the time. He was always having falls in the care home, and they were having to send out a doctor or sometimes an ambulance, which was very disturbing for him, but also a very expensive type of care. Keep having the ambulances go out to him. And a little girl, a little 9-year-old girl, managed to get the old man to start speaking. And the old man said, when I was young, I used to enjoy going on the fun fair. I used to enjoy going on rides on the fun fair, on a roller coaster on the fun fair. And the little girl knew that a local online center had virtual reality headsets that they could lend. So she got a virtual reality headset, took it along when she next visited the care home. This is a 9-year-old girl. And the old man put on the virtual reality headset, and he could experience going on a roller coaster ride on the fun fair, like he used to do when he was young. And as a consequence of that, he became much more communicative. He started talking. He stopped self-harming, and he didn't have so many falls in the care home because he didn't need so much medication. He was having sedating medication to stop him scratching himself, and he didn't need that anymore, and he didn't need the ambulance anymore. And that care home experienced a very big reduction in ambulance call-outs. So apart from being a very heartwarming story, it also had some very clear financial benefits and some very good health outcomes for that man. And that little girl now says, when I grow up, I want to be a health professional, because I've seen what some of those technologies can do. And I just think that's a really nice example of where a technology, virtual reality, can enable people who have no digital ability at all, no digital skills, to engage with a wider world. But the other really important thing I think about that story is that it uses not just technology, but a community asset, intergenerational mentoring. So it uses the asset of children in a local school linking with a care home of older people. And I'm just going to finish by an example of what libraries can do. So this is an example from an initiative in Leeds. So Leeds is a big city in the north of England, a city with a lot of poverty and deprivation, an old industrial city where a lot of the old industries aren't there anymore. but also a city that has really put a lot of drive into trying to make Leeds 100% digital city. And they have an initiative called 100% Digital Leeds. It's a multi-agency program with involvement of the health services, the housing services, transport, but it's led by Leeds Libraries. So this is like a library service leading an initiative. And it's just fantastic to see the things that they've done. They've distributed digital devices, mainly iPads, and data SIMs, so people have data, to those most in need in the community. They've trained digital champions, so people who are community leaders have developed digital skills that they've then passed on to others. They've done a lot of signposting of digital tools and resources and self-management apps. And crucially, they've mapped availability of free public Wi-Fi in the city. Because of course, one of the things that happened in lockdown was that all the places people used to go, if they didn't have a device or they couldn't get onto Wi-Fi in their own environment, closed down. So cafes where people used to go to get online were closed, libraries were closed, schools were closed. So 100% Digital Leeds mapped where there was still free public Wi-Fi, things like street Wi-Fi, where there was Wi-Fi hotspot in the street. So that was really, really powerful and useful. And they've now produced a digital inclusion toolkit to share what they were able to do in Leeds and to make that knowledge available to other cities wanting to do something similar. So I really commend that as a really great example of how a library-led initiative work with local communities to really combat the problems of digital exclusion in that city. I'll stop there. If you have questions, I'm sure Anne and I are very happy to answer them now, but if you think of things later and want to follow up, please do email me. You can follow me on Twitter or direct message me on Twitter. I'm quite active on that. And I've written several articles recently about the challenges of digital inequality and COVID, and those I'm sure you can check out as librarians, and I hope that those will be of interest as well. So thank you very much for listening, and thank you so much to the organisers for such a great conference.
Thank you very much, Mr. Bob, for such a wonderful session. Actually, now it's time for questions and answers. So if any one of you have a question, you can just post them in the Q&A chat box. I have a question for both of you, our speakers. Are we going to continue to provide services remotely? Many companies plan to do so. What about libraries? Also, what kind of urgent skills required after the pandemic? So this is the first question.
Shall I answer first, and then Anne can follow on? I think absolutely we will continue. I think that the rapid advance of digital services has been stimulated by COVID, but I think it's a sustained trend. I think many people will continue to work partly from home. A lot of companies have said they're not going to open their offices to all their staff. I think there will be more online education. I think there will be more online health consultations. And the COVID pandemic did accelerate people getting online for the first time. Only 2 days ago, we published a digital inclusion update in this country, and a really interesting finding was that the COVID pandemic sparked people getting online so much that we are now where we thought we would be in in 2025. So instead of where we are now, it's 4 years worth of expansion of digital services and digital access in 1 year because of COVID. And I think that will absolutely continue, and we need to just not think it's just a COVID thing, it's a major societal shift.
Okay, thanks, Bob. I think looking back at the experiences of the last year in terms of service provision, there have been advantages and disadvantages. I think using technology, using remote working gives us much greater reach. It means that we can send out and communicate much more widely, and people are, because they've had to come and find us digitally, they're more aware that that can also support the type of transactions they used to have with us face to face, that those skills can translate into that environment. There are slight challenges in terms of the way that organizations work generally. I think when you share, and we have staff across the whole of England, so we were already very dispersed. So my team is dispersed around the whole of England. We took a decision to embed people around the regions and with teams, so they were closer to where people worked, so that they weren't all just in one central facility, they were throughout the country. We know that if people have an experience of meeting a knowledge broker or an information specialist, they're often much more likely to come and seek out information. So doing things like induction, coffee mornings, pop-up libraries has been really useful. So we have to try and find a way of translating that outreach into the digital world. But we also have to make sure that the teams we work with don't become more insular because they're not meeting together in public. And I think that's an issue. It's great that people don't have to have long journeys commuting on crowded trains and delays. But I think there's a lot of consciousness that there have been demands on people's mental health from working in this environment. Being a public health agency means that people have been under a lot of pressure, not just in their own lives, but responding to the pandemic. And not having that space between work and home can be very challenging for some people. And again, the less resource you have, if you're in a shared place of living or you don't have the facilities, it can be very challenging, I think, working from home. So I think we'll get to a point where there is more choice, but we have to try and make that work. In terms of urgent skills, certainly there's a need to be better at virtual training, running workshops, running training sessions whereby you can make the content interesting, there's interactivity, to get those things in place. I think we have an urgent need to be better at how we tailor information. So if we're sending results from searches out or responding to inquiries, we package those up much better in a more personalized form. We've had to learn a lot quickly about the changes in the way that evidence is being generated. So clearly, a lot of the reviews and summaries of evidence that get provided have had to cope with a massive amount of new publishing, and the quality of some of that has been a challenge. So I think they're all things we have to look at. We are involved in a project, and this is somebody in a university who developed an app that people could use to ask questions around their healthcare. So look for evidence on health. And it's hoping that it presents that information in an accessible way. But what they want to do is they want to put a chatbot on the app so that it can help people refine their question. Now, as librarians, we're all familiar with users who have a request, but it's very general and we need to work with them to work out what it is they really want. So we're working with this group to use examples of searches, the questions that people have asked us, and to get the team to look at what process they went through with the person to refine the question and to see whether or not that can be translated into a machine learning situation. So that is quite interesting. But that we go back to what I said earlier, how far do we have to go down the road to become data scientists as well as information scientists? And I think that is a bit of a challenge.
Okay, here's another question from Maria Cotera. She's saying that she loved both your presentations and Bob's demonstration of getting Alexa to provide voice activated health information, even if by error. So thank you both. Her question goes to Dr. Annie Brice. How can we as librarians in different countries, sectors, and at different stages in our careers contribute to supporting the advocacy work we still need to do, to not just sit at the table, but be key stakeholders promoting the importance of our work, providing access to reliable health information for all?
Okay, and that's a big question. And I think it needs two different approaches. When I was a young librarian, my first professional job, I worked at a postgraduate medical library in London. And the librarian there, Lindsay Curtis, was a great role model and very much ahead of her time. And when I was first there, I remember saying to the other staff, she's never here. She's always out somewhere. Does she spend all her day in the coffee room? And the answer was yes. She wasn't there because she was out going into people's offices, going into the staff, you know, making herself walk around and meet people. So I think we have to take a leap of faith sometimes and just get out there. It's quite challenging sometimes if you're in a room full of very senior people with lots of knowledge and experience in areas that you don't have. But I think if we believe firmly in what we can add value in, that we just have to make that jump. I think it helps if we've got good examples. So as I say, we've been trying to collect impact stories. We've been trying to look at where it is we add value so that we've got practical examples that we can show to people. The best advocates are the people we work with who we've helped or who we've provided some valuable service to, because they have a much greater impact with their peers. So I would seek out people that you have. If you're at a conference or a meeting, go up and speak to people, or follow or send them a message on Twitter or LinkedIn. Always be looking for opportunities to share what we do. The worst that can happen is that people will not follow it up. But I think over the years, you have to develop a little bit of a thick skin. And as long as you believe in what you do and you're doing it in a polite and careful way, then I think we have to actually just take those skills and practice. There's a great series that IFLA produced called the 10-Minute Library Advocate. And these are very small. This is, and we, after hearing about these at an IFLA conference a couple of years ago, took these back to the team and we had a session. And the great thing about these is you don't have to be a senior manager to do this. Every single person can do something every day to help build on advocacy. So things you can do in 10 minutes. And I think that's a really good point. We have there was an exercise, a sort of campaign in our National Health Service a few years ago called Making Every Contact Count. So we try and operate a Making Every Contact Count theme in our service. So if you're talking to somebody or you're giving them something, it's an opportunity to say, oh, and did you know we do this training in X, or can we help you with this as well? So, and going back to the last question, the challenge for us now is to make our websites, our online services, to make them have the same transaction and connection with people as we would see to them face to face. So I think, yes, we need formal advocacy campaigns, but every single person can make a difference.
Okay, thank you. Another question, it's related to the role of government of keeping citizens informed, and what's the importance of government providing valid, updated information and being transparent with their citizens?
I think that's one for you, Bob, as a former lead for NHS Choices.
Yeah. I think it's very interesting, the people's understanding of the role of authority in information. In England, or the UK certainly, there is very high trust in our National Health Service. So the National Health Service, the NHS, I mean, it's been described as the nearest thing to a national religion we have in the UK. You know, it's very highly respected. Everybody has engaged with it during their life. It's saved people's lives. It's, you know, it's where people have been born and died. You know, it's absolutely embedded in our national psyche. And any information that is branded as coming from the National Health Service tends to have a high level of credibility and trust. I think there's not the same level of credibility with government, and I think people do distinguish between government, which you know, it obviously has a political context and people might not trust and believe, and the NHS. So certainly through the COVID pandemic, public communications that come from the National Health Service and perhaps are presented by trusted scientists and clinicians have a higher level of credibility than politicians, and I think there's been an important separation of those voices. Hasn't always been clearly done, and you know, very often the speaking to the nation that I showed, where Boris Johnson, the Prime Minister, had the website on his podium, has had a politician and a trusted scientist speaking side by side. So sometimes those boundaries can be a little blurred, but I think, you know, there are trusted authorities, scientists, clinicians, health services that perhaps have a stronger voice than government in these times.
Yeah, that's just to add, it's an interesting question, and the one that we've been debating with our partners and colleagues in HIFA around, and it's something that we hope to cover at a session at the IFLA Congress this year, around what should the role of governments be, and how should they be held to account for access to reliable health information in their countries? How much does the role of the state, how far should it go? Is there not a moral or responsibility to make sure that citizens have access to the best available evidence on their healthcare to help them make decisions? So it's an interesting question. And I think one thing that's been very apparent in the pandemic has been the amazing collaboration across the world in areas of complex science. So WHO have run communities of people who are interested in or concerned with the generation of good quality evidence, good quality research around COVID-19. And it's been very, very encouraging to see the extent to which people from different cultures and different places will work together to try and solve some of these scientific issues. And I think the ability of people to come together in the face of this has been excellent. But that again, it's the difference between organizations, scientific organizations, different sectors, and the role of government, I think, is quite a difficult one.
Okay, thank you, Dr. Annie. Now we have a question from Ms. Nawal Masalhi. I think she wants to ask her question live. So I think you can unmute your microphone so you can ask. Ms. Nawal?
I think she probably raised her hand by mistake.
Maybe.
Or, yep. Okay, she's back with us, I think.
Okay, we have another attendee, Surdina. She wants to ask a question. Okay, you can unmute your microphone.
During COVID-19, our government was so reluctant to give information that were utilized by the people. This incident was not covered by any other institutions, and we had to go on our own to find out certain information that was available from different sources online. And some of the broadcasts were helping in this aspect, but there were so many contradictory information. To do so, we have to build up a team to work on this. Do you advise on having any international source to get the information from?
So this is again another question that I think we can both answer, and particularly as we work together on the national approach to reliable information for patients and the public. And the reason that I went to work with Bob on that was that it was felt important that I'd mostly worked with health professionals, but that the access that the information going to the patients and the public should be based on the same evidence that was available for health professionals. So I think the word team is very important. You definitely need teams of people who have different skills in handling complex information. And it's very difficult when you're taking, particularly at the moment where you have a situation where new research is being undertaken and published all the time. There's been a rise in information being provided as preprints, so it may not have gone through the same peer review as formally, so it's very rapidly written up and rapidly done for obvious reasons. You need to make sure that you have people who are able to take those complicated scientific uncertainties and write them in a way which is accessible to everybody. And I think those skills of making sure that when you make information available to the public, that it is still accurate and robust is a difficult one, but it can be done. And in organizations such as the Cochrane Collaboration, as Evidence Aid, these are people who are not only highly skilled in doing research and synthesizing research, but they also work with patient groups and consumers and the public to make sure that it's a team effort to provide that evidence.
Yeah, I think as Anne says, it's important to understand that the development of the national website for patients and the public, the NHS website, was part of the same strategy as developing what was then the National Electronic Library for Health. So the idea that, you know, we develop online health resources for professionals, but it's equally important that we develop those for patients and the public as well, and that both those knowledge sources are based on the same high quality evidence. And, you know, I think increasingly our understanding of who's the expert is not as simple as the professional and the patient. The professional may have a knowledge in a certain area, but a patient, for example, a patient living with a long-term condition, lives with that condition every hour of the day, every day of the week, and is a considerable expert in their own right. So we need to recognize that. And in fact, you know, what we see often nowadays is that in many areas, patients may be more expert than clinicians, both in using some of the new technologies, apps, devices, etc., and in the knowledge about the condition itself. In terms of using, you know, examples from other countries, I mean, we'd be very keen to see some of the way in which we've developed things like the NHS website looked at as an example for other countries. I did actually do some work with the Saudi Arabian government, who took the example of the NHS website and developed a King Abdullah Health encyclopedia online. So that was an example. But, you know, it's not as simple as just, obviously, I mean, you'll understand this very well, it's not just about taking content from another organization's website and translating it. You know, there's many kind of cultural challenges and differences. You know, much of public health information is very culturally specific. You know, you look at things like alcohol use or diet or sexual behavior, they're very, very cultural topics. So we need to understand in our country as well the importance of that cultural framework for information as well as simple language.
Okay, thank you, Mr. Bob and Dr. Annie, and thank you to each and everyone for attending our first session. And now it's time to close this session. Randa.
Thank you very much, Bob and Anne. It was very interesting, a lot of information. And your mentioning of the NHS reminded me of the documentary Sicko. There was a part where they talked to the parliamentarian Tony Benn, passed away, and he said a very nice sentence. Says, no revolution will happen in the UK, but if the government decides to cancel the NHS, that's when the British people will revolt and they will have a revolution. So that shows you the importance of the NHS. Yeah. And as you just mentioned, even the Prime Minister gave it such a huge place during his TV hosting, when he comes up and talks to the people. So that's the importance of information, and that's where the information comes from. And I hope that we will be able to get to that point in the rest of the world, especially the Arab world, where we do have our own cultural differences and cultural problems and our own special cases as well. Thank you very much for joining us for this session. And as you said, we hope to see you in Lebanon as well. And you're welcome to stay with us for the rest of the sessions, or if you have other things to do. Thank you very much for your time. It was appreciated. Thank you very much. And now, thank you. And now we're going to have a slight break. And we should be back at about I believe at 4:15 to begin the next session, with our speakers. So please, you can go ahead and visit the sponsors booths if you want during this time. And I'd just like to say thank you very much for being here. Thank you, everyone.